Unique design of Pemvidutide. Disclaimer: the contents of this video are not financial advice. It is intended for entertainment and educational purposes only. Glucagon side effects. We learned at the end of video 1 that glucagon receptor agonists can have severe cardiac side effects, particularly when administered in high doses. It can increase heart rate, blood pressure, and myocardial oxygen demand. We have seen this in retatrutide, another glucagon agonist drug under development. Glucagon receptor agonists under development and their potency. When considering combined drugs, potency of each component is measured as a ratio compared to the other components of the drug. Mazdutide. Mazdutide is a GLP-1 glucagon drug that was just recently approved for weight loss in China. Its GLP-1 to glucagon potency ratio is 5:1. This potentially explains why no severe cardiac side effects were observed during its phase 2 and 3 trials in China. However, unlike Pemvidutide, Mazdutide's trial studies did not have any primary endpoints beyond just a subject's weight on a digital scale. Additionally, it will require at least a shortened trial before Mazdutide can be approved for usage in the USA. Pemvidutide. Pemvidutide is a GLP-1 glucagon agonist drug under development by Altimmune. Its GLP-1 to glucagon potency ratio is 1:1. However, the molecule is uncased in a proprietary coating called EUPort by Altimmune. This coating allows a slow diffusion of the drug, equating to a Tmax, time to maximum blood serum concentration, of 72 hours after its weekly injection. This is the reason during Pemvidutide's phase 2 study, subjects only had minimal increases in heart, no occurrence of arrhythmias, and actually a decrease in blood pressure. Additionally, Altimmune obtained ECG electrocardiogram on phase 2 subjects and saw no evidence of QTc intervals, a measurement in assessing the rhythm of a person's heartbeat. Survodutide. Survodutide is another GLP-1 glucagon agonist drug being developed by Boehringer and Zealand Pharma. Its GLP-1 to glucagon potency ratio is 8:1 because there is significantly less glucagon agonist compared to GLP-1. Survodutide so far in its trials have observed no signs of any cardiac toxicity such as tachycardia and arrhythmias. It seems survodutide, just like Mazdutide, chose to minimize side effects by keeping the proportion of the glucagon agonist its molecule very low. Retatrutide. Retatrutide is a triple agonist GIP, GLP-1 and GCGR molecule being developed by Eli Lilly. Its potency ratio for GIP, GLP-1 and GCGR is 8.9 to 0.4 to 0.3. Even though retatrutide has small amounts of glucagon in its molecule, it still had significant cardiac side effects in its phase 2 study. This included tachycardia and arrhythmias. Conclusion: Altimmune has done an amazing job in balancing the hyperglycemia aspect of glucagon with the hypoglycemia effects of GLP-1. In effect, Pemvidutide is blood sugar neutral. This is especially important because only 20% of the obese population have diabetes, while 70% of obese patients have dyslipidemia or high cholesterol. Pemvidutide has been shown in its phase 2 study to significantly lower LDL and triglycerides even in patients who have already plateaued while taking statin drugs. Additionally, Pemvidutide is the first drug to demonstrate in study to significantly lower small particle LDL, especially dangerous to our health in its ability to block small blood vessels and thereby cause stroke and heart attacks. Being blood sugar neutral also conveys another advantage to Pemvidutide in both diabetic patients and non-diabetic patients. In diabetic patients who are already on diabetic medications to control blood sugar, adding another medication like a traditional GLP-1 drug will require close monitoring and adjustment of existing medications to prevent dangerous episodes of hypoglycemia. Similarly, in non-diabetics, a physician does not need to slowly titrate Pemvidutide to allow patients to adjust to its effects, because Pemvidutide does not affect blood sugar levels. In short, the designers of Pemvidutide have crafted the molecule in such a way as to allow us to have our cake and eat it too.